Hi, I'm Sean Juarez. I'm a doctor of physical therapy with Vail-Summit Orthopaedics Neurosurgery, here to answer some live audience questions for Vail Valley Live. What is blood flow restriction therapy and how is it beneficial? So blood flow restriction therapy has to do with using some type of tourniquet on the arms or legs in order to restrict blood flow to the area, and then you're performing exercises with it. What we found is that with research, you can do a lot lower loads of exercise and lower intensity and get the same benefits as far as your hypertrophy and strength within the muscle. So that's kind of the best part about it, is that you don't have to use high weights and higher intensities. When do I need to see a physical therapist, and do I need to go to a doctor first? So with this question, it's a little bit variable. If you are visiting into the Valley and you want to do just cash pay, you can come in to see us without seeing a doctor first. If you are trying to use insurance, it depends on the type of insurance that you have, whether or not that you need to use a referral in order to come and see us. If you're curious as to what to do with your insurance provider, the best case is to contact them to see if you do need a referral in order to come into physical therapy or not. Next question, how important is stretching really? Well, really, it's not that important. What I would say is before you go on the mountain and before you're skiing or snowboarding, the best thing to do is called a dynamic warm-up, where you are doing movement therapy and movement exercises in order to get your muscles ready. When you get done skiing, then you can do more static stretches, and that can help loosen up the muscles after you're done. What are some tips to avoid injury on the hill? Majority of the injuries that happen on the hill typically come when there are a lot of people on the hill. So the best case scenario is to try to avoid areas where there's big crowds. If you can get yourself nice and strong before the ski season, specifically in the quads and the glutes, then that also can help prevent some of the non-contact injuries. But overall, if you can avoid big crowds on the mountain, that's the best way to avoid injury. What are the benefits of dry needling? Does it hurt? So there's a lot of research that's been done with dry needling. Dry needling is using acupuncture needles in order to go into the muscles, so we're using a more westernized approach for it. What we found is that it helps with muscle relaxation, it helps bring blood flow to the area. It can also help stimulate a lot of the motor neurons, so then the muscles actually start firing better. As far as if it hurts, majority of the time it does not hurt. However, there are certain nerves and the venous system where you can't always avoid that, and sometimes that can be uncomfortable, but if we can avoid those, then it typically does not hurt. Thank you for your questions. This is Sean Juarez with Vail-Summit Orthopaedics Neurosurgery with Ask a Doc from Vail Valley Live. See you on the slopes.